Welcome to the Vinci Xi Vision Best Practices session. In this video, we will cover best practices to prevent and troubleshoot endoscope fogging. Fogging of the Vinci Xi endoscope tip can affect visibility during procedures. Endoscope fogging occurs when a temperature differential exists between the scope tip and the air in the body cavity. To prevent endoscope fogging during setup, the sterile staff and surgeon should follow these guidelines during setup and procedure. Consider increasing the operating room temperature a few degrees to minimize the difference in temperature between the endoscope and the OR environment. Also, with the Vinci Xi system powered on, begin warming the endoscope tip by connecting the endoscope to the endoscope controller at least 30 minutes prior to the start of a procedure. The illuminator does not need to be turned on during this time. In addition, before inserting the endoscope into the patient, briefly submerge the tip of the endoscope into water at 55 degrees Celsius or 131 degrees Fahrenheit for no more than 15 seconds. If using a thermos, do not allow the endoscope tip to make contact with the sides or bottom of the thermos, and maintain full control of the endoscope to prevent it from tipping over. When done, thoroughly wipe the tip of the endoscope with dry, sterile gauze. While wiping, pay close attention to the edges of the recessed tip. When inserting the endoscope into the cannula, make sure that the endoscope tip is inserted beyond the cannula tip. Leaving the endoscope tip within the cannula may cause the endoscope tip to cool. To prevent endoscope fogging during the procedure, use heated insufflation to prevent a temperature difference within the body cavity. In addition, connect the insufflation tubing to a cannula that will not be used for the endoscope for the majority of the procedure. Advanced insufflation products such as SurgiQuest Air Seal are recommended. If using the Urbe Vio DV generator, the Swift Coag mode for monopolar coag cautery is recommended to reduce smoke and the occurrence of endoscope fogging. Using short bursts of suction at the cautery site will help minimize smoke buildup. Also, consider placing the smoke evacuation tubing on a cannula not intended to be used for the endoscope. The Vinci Xi endoscope features an optimized fixed focus range of 2 to 14 centimeters. The endoscope will be in focus within this range from the tissue. The Vinci Xi endoscope has a wide field of view which may cause the user to place the endoscope closer to tissue. This may result in fogging during the use of monopolar cautery. To reduce fogging during monopolar cautery, it is recommended to pull back the endoscope and use the 2x digital zoom settings found on the display tab via the surgeon console touchpad to maintain a similar view. To manage fogging during a procedure, use a scope warmer with water at a temperature no greater than 55 degrees Celsius or 131 degrees Fahrenheit. Briefly submerge the endoscope tip in the water for no more than 15 seconds. If using a thermos, do not allow the endoscope tip to make contact with the sides or bottom of the thermos, and maintain full control of the endoscope to prevent it from tipping over. When done, thoroughly wipe the tip of the endoscope with dry, sterile gauze. While wiping, pay close attention to the edges of the recessed tip. When done, reinsert the endoscope onto the patient cart arm.